Assalamualaikum and hi, my name is Jannatul. I'm from DEU30023. Today, I'm with my team members, HURIN and HAFIZAH, will be present case study 2, anatomy and physiology. So, for the first point of nervous system is resting potential and how an action potential is generated. The resting potential is the electrical potential across the cell membrane of a neuron at rest. Typically, the inside of the neuron is negatively charged relative to the outside, around 70 millivolt. This state is maintained by ion channel and the sodium-potassium pump, which actively transport Na plus out of the cell and K plus into the cell. An action potential is generated when a neuron receive a strong enough signal. This causes sodium channel in the neuron's membrane to open, allowing sodium ion to rush in. As more sodium enters, the inside of the neuron becomes positively charged compared to the outside. This rapid change in charge travels along the axon as an electrical impulse, allowing the neuron to communicate with other cells. After the peak of the action potential, potassium channel open, letting potassium ions exit and restoring the neuron's original charge. For common disorder, disease and injuries related to nervous system, first we have an example, Alzheimer's disease, a progressive brain disorder that affect memory and thinking. It leads to confusion and difficulty performing everyday tasks. Then we have Parkinson's disease, a movement disorder caused by the loss of dopamine producing brain cells. It leads to tremors, stiffness, and burden issues. Then we have stroke, a medical emergency where blood flow to the brain is interrupted either by a clot or bleeding. This can lead to loss of function or control over body parts depending on the affected area. Then we have multiple sclerosis. An example is an autoimmune disease where the immune system attacks the protective sheath myelin covering nerve, resulting in nerve damage. Then we have epilepsy, a neurological disorder characterized by recurrent seizures due to abnormal electrical activity in the brain. Related diagnosis, technologies or equipment. First we have electroencephalography, EEG, to measure electric activity in the brain, useful for diagnosing epilepsy and sleep disorder. Then we have magnetic resonance imaging, MRI. Then we have compute tomography, CT scan, use X-ray to create cross-sectional image of the brain, useful in identifying bleeding, tumors, and skull fracture. Also, we have nerve conduction study.
Hi, my name is NURUL FATINI binti YANI and my matric number is F1034. So here I want to continue to present about blood. We used to know that the blood have three main types, which is white blood cell, red blood cell, and the last one is platelets. Okay guys, this type of blood have their own function and characteristic. So first is red blood cell. It is function to carry oxygen from the lung to tissues and organ, and it also transport carbon dioxide back to the lung for exhalation. Then the characteristic is they have a biconcave, disc-like shape that minimize surface area for gas exchange. They lack a nucleus, allowing more room for hemoglobin and the protein that bind oxygen. Secondly is white blood cell. It functions to defend the body against infection and foreign invaders. It because the white blood cell are part of the immune system. Then the characteristic is it have nuclear and vary in size, shape, and number depends on the body's need. And the last one is platelet. It functions to help prevent excessive bleeding by forming clot at injury site. The characteristic of platelet is they have a small cell fragment without a nucleus. When they active, they change shape to damage blood vessel. Related diagnosis technologies or equipment to complete the blood count, CBC, we use automatic hematology analyzer to measure the levels and type of blood cells. Then, we also use the PCR machine and genetic analyzer to detect specific genetic markers or mutation that related to blood disorder. And lastly, we use flow cytometry to analyze blood cell characteristic and diagnosis blood cancer like leukemia.
Cardiovascular system. Blood flow through the heart. At the deoxygenated blood returns, blood that has delivered oxygen to the body return to the heart through two large veins called the superior and inferior vena cava. The blood enters the right atrium, a chamber at the top right of the heart. From the right atrium, blood flows through a valve into the right ventricle, the chamber below it. When the right ventricle contracts, it pumps the blood through the pulmonary artery to the lung. Here the blood picks up oxygen and release carbon dioxide. The now oxygen-rich blood returns to the heart via the pulmonary veins into the left atrium. Blood moves from the left atrium through another valve into the left ventricle, the strongest chamber of the heart. The left ventricle contracts and pumps the oxygenated blood out through the aorta, the largest artery delivering oxygen to the rest of the body. Cardiovascular disorder. First, coronary artery disease, CAD. Narrowing of the coronary arteries due to plaque buildup, leading to reduced blood flow to the heart. Second, heart attack, myocardial infarction. Occur when blood flow to a part of the heart is blocked, causing damage to the heart muscle. Number 3, hypertension, high blood pressure. A condition where the blood pressure in the arteries is persistently elevated, increasing the risk of heart disease and stroke. Number 4, heart failure. A chronic condition where the heart does not pump blood efficiently, leading to fluid buildup and shortness of breath. And number 5, arrhythmias. Irregular heartbeats, which may result in palpitation, dizziness, or even sudden cardiac arrest. Related diagnosis, technologies, or equipment. First, electrocardiogram, ECG, measure electrical activity of the heart, useful for detecting arrhythmias, heart attack, and other heart conditions. Number 2, we have echocardiography and also cardiac catheterization. Number 4, we have stress test to monitor heart function under stress, usually on a treadmill, to identify potential blockage or abnormalities. And we have blood pressure monitor.
In respiratory system, there are mechanisms of inhalation and exhalation. As you can see, the process of inhalation is when the diaphragm contract and move downward, while the intercostal muscle contract. This expansion increases the volume of the thoracic cavity and decreases the pressure inside the lungs. So the result due to lower pressure inside the lung relative to the outside environment. Then, exhalation process is usually a passive process where the diaphragm and intercostal muscle relax. This is causing the thoracic cavity to decrease in volume. This increases the pressure in a lung. So, the higher pressure inside the lung push air out through the airways. Common disorder and disease that related to the respiratory system. First is pneumonia. It is an infection of the lung tissues that causing by inflammation of the alveoli, which may fill with fluid. It can make cough, fever, and difficulty breathing. Secondly is asthma. It's a chronic condition that can be characterized by inflaming and narrow airways that causing a wheezing, shortness of breathing, and coughing. Thirdly is lung cancer. Start in the lung, it is often associated with smoking, although it can also occur in non-smokers. The symptoms may include coughing, chest pain, and unexplained weight loss. Lastly is a tuberculosis, which is TB. It's actually an infection disease that caused by Mycobacterium tuberculosis that affecting the lung and system include persistent cold, fever, and weight loss. Related diagnosis technologies or equipment. We use sputum analysis to detect infection like tuberculosis, which is TB or pneumonia. Then, we are also use peak flow meter to monitor airways contraction, especially in asthma patients. Lastly, we use spirometry to measure lung function by assessing the volume and speed of air inhaled and exhaled.
Process of filtration in urine. Filtration at glomerulus, the processed blood is filtered, allowing water, electrolytes, and small molecules to enter the Bowman's capsule, while larger molecules remain in the bloodstream. Reabsorption at proximal convolute tubule, loop of Helm. Distal convolute tubule, the process is essential nutrients and ions are reabsorbed back into the blood, while waste product remain in the filtrate. Secretion at distal convolute tubule and collecting duct. The process is additional waste substance are secreted into the filtrate before being excreted as urine. Related diagnosis technologies or equipment. First, we have urinalysis, a common test that analyzes the physical, chemical, and microscopic properties of urine to detect abnormalities. Then we have ultrasound and also cystoscopy.
The last topic is reproductive system. Reproductive system is essential for producing and transporting gametes. It also plays a key role in regulating sexual and reproductive hormones. The hormone and their function that influence the male and female in the reproductive system. For female reproductive hormone, first is estrogen hormone. It's primarily produced in the ovaries, and it also regulates the menstrual cycle and promotes the development of female secondary sexual characteristic and prepare the uterus for pregnancy. Then secondly is progesterone. It is produced by the ovaries and the placenta during pregnancy. It also maintains the uterine lining and support early pregnancy by preventing uterine contraction. While the main reproductive hormone is testosterone. Its function to produce primarily in the testes. It also responsible for the development of male secondary sexual characteristic. After that, LH hormone is produced by the pituitary gland, and it also stimulates the testes to produce testosterone. And the lastly is FSH hormone. It's produced by the pituitary gland, and it also works with testosterone to promote the maturation of sperm cell in the testes. The role of placenta is first to supply the fetus with nutrient and oxygen from mother's blood. Second, the placenta produces several hormones that support pregnancy. And the last one is placenta act like a barrier that protect the fetus from curtain infection and harmful substance. Related diagnosis technologies or equipment, first is ammonia synthesis, a procedure that collects amniotic fluid, which is curtain fetal cells, to test for genetic condition, fetal infection, and curtain developmental abnormalities. The equipment is ultrasound guidance. And the last one is ultrasound imaging. It used throughout pregnancy to visualize the fetus, placenta, and uterus. The equipment we use is ultrasound machine.